What we're doing is we're delivering insights to doctors and the medical team so they can treat patients earlier for their complications. So the impact will be that actually people will go through their treatment much more easily, and therefore with more capacity in the hospital, have more people have the availability of care and access to care. So that's the drive for impact that we have.
Is it also true that you're looking for the next steps? What is most important to you, and what stakeholders would you like to involve in the next steps?
Right. Well, we feel that, or we see that the only way of delivering the value is in the workflow of the end users, of our target audience. And to do that, we need to be in their workflow and also in their digital workflow. So we are a 100% ecosystem player. We work with all the endemic big corporations that are offering their services, so we can fit in there. We can be part of that plumbing system if you want. So for us, there's no other way. We see that partnerships are the only way to deliver this at scale. And also talking about impact, the only way that we see that we can reach that is when we work together. So if we want to reach our goals, which are very un-Dutch in a way, 50 million people in the next 5 years per year, then we need to do that. It's the only way forward.
And do you have a preference for any part in the world? Is it, you said it's not a Dutch way because it's huge. Can you explain a little bit more? Do you have any international ambition?
Of course, so the first partner actually that we have is the biggest electronic health record vendor in the world, which is Cerner, a US corporation. And we're looking at the different geographical areas and matching that with the right partners. So we're doing exactly that. So this is the third partner that we added, and we're just continuing that conversation. That way we get to standardize the data that we get and the output that we deliver, and in that fashion it's also get cheaper for end users. So in that way we optimize the impact as well.
Do you believe it might be easier to go to market abroad with regards to all the complex regulatory landscape that we find here?
I think you will see this in different shapes and forms everywhere. So I think, but the way that the governments and the government institutions go about is different. So the FDA is more of a dialogue, while in Europe it's more bring everything, be ready, and you deliver. There's no dialogue, there's nothing in between. And also if you look at the option for startups really, and you want to really cultivate innovation at that level, what you see works better in the US as well, if I can be frank. There it is, the conversation, you can get a license before you're fully registered, and that way you can show traction and actually get more investment options that way. So here it's more of a challenge. The gap is bigger over here in Europe, and that differs throughout the world, I guess. South America is a bit different, less regulation and a bit more clarity, to be fair.
So this seems to me that actually a part of the value track for personalized health should be with regards to the call to collaborate on the regulatory compass for medical devices. This should be definitely one of the dialogues that we should have, that we should organize together with policymakers, peers, and perhaps other stakeholders to open up that dialogue and make sure that in Europe we also understand how we can make this work for everyone and be an enabler for your people like you, for solutions that you bring to the table.
Yeah. There are a lot of startups that actually work together on this. So ultimately you are competitors, but I think that's something that is not in the way of working together. It's more of a challenge to work with bigger corporates, to be fair, but even that can be overcome. So I think it's really, the dialogue is there. Now we need to cultivate it and bring it forward and actually connect it to people that make the rules and make them accessible. I think the last bit is even more challenging than the first one.